far as euthanasia is concerned and your PIL goes, just for our viewers, establishing a context.
Constitution bench, and it is being argued before the Constitution bench. The context is that this PIL was filed by our founder director, Dr. Mr. H.D. Shorey, in 2005. Uh, he was already 93 years old when the PIL was filed, and at that stage of life, the thought of impending death is uppermost in one's mind.
What is probably missed out in the whole, maybe missed out in the whole debate, is what is called end of life care, which is possibly, if you stretch the argument, is probably part of passive euthanasia, which is probably one of the more urgent needs in terms of a patient in a critical situation, in a life-threatening critical situation, long-standing disease, not any critically ill patient, but a person who has been critically ill for a long time or with severe chronic illnesses which have no chance of recovery. Then there is a futility of care in that setting. On life support systems or impending life support systems, they are a subset of patients which we see in the ICU or in the hospital on a regular basis. Okay, and as not just an individual doctor but a team of doctors thinks that there is almost a futility of care, the patient is not going to improve, and it's almost almost immoral to continue with high levels of life support in these patients. Increasing the cost, increasing the suffering of the patient, prolonging his life without reason, increasing the suffering of his family and his loved ones. In that case, withholding or withdrawal of support is more like end of life care rather than passive euthanasia.
If you look at the cultural context of Ichha Mrityu or euthanasia as it is called in Hindi, and some religious sects like Jains, there's something called Santhara, where you don't eat, you don't consume any food or water and for several days, and then you give up your life. Religious practices have existed, but here the question is of how do you legalize that, because there is always a chance of misuse or abuse.
Euthanasia, somehow the word gives a negative connotation to a lot of people. I would say end of life care, and those are the terminally ill patients I'm talking about, who have been on life support for long or are so terminally ill, who have been, and there is what we call in medical terms futility of care, that who are not going, the chances of improving to a good quality of life is almost negligible. Right. That is the subset which is more essential to look at first, and that is what is absolutely achievable in the context, because it is in some ways already being done. But if we regulate it, legalize it, and have systems in place to check, and it should not be an individual doctor's decision, it has to be a team of doctors with the family. It cannot be only a doctor's decision. With close family, repeated discussions. It cannot be a one-time discussion and you decide. Okay, patients' families end up taking a large number of patients home as left against medical advice, letting them die at home in terrible conditions. They should ideally be let to pass away with dignity, in comfort, with sedatives if necessary, with analgesia, without being in pain, without discomfort, without the family having to see them gasping for their last breath. The family should be comfortably able to sit with him or her where the person is absolutely comfortable and spend their last moments praying or whatever their religious or spiritual activity they want to do with the person. There has to be a dignity to it, which is missing because of the supposed illegality of it.
To challenge and sort of dispel the so-called, the other effects that, which compel us not to think about them. These are times when we should take them up, and we should see them being handled more responsibly. Formats like this are encouraging for people to think about it.
The moment you legalize, there are going to be problems, whether it is active euthanasia, that comes later, but even passive euthanasia, I think instead of going for a legal framework, we need to go for...
euthanasia, a doctor would need that kind of system support. At the end of the day, otherwise he's a murder accused.
Yeah. So you need to have a guidelines instead of a law.
Legalizing does not mean that giving a legal certificate to the doctor that you can pull the plug. It just gives you a legal framework of how to work within it, within the ambits of the morals and ethics of the profession, And no judge can take a decision if that patient is futile, is there a futility of care. It can only be a group of doctors who can do it, in spite of all the problems that we have in the doctor community, unfortunately or fortunately.